X-ray may be the most cost-effective approach. And we should have a little bit more about this on the next slide. And this is because with TB and homelessness, TB is higher in these homeless populations. Most TB occurring in the homeless are primary infections. And when you have a large group of homeless people, this produces outbreaks with large clusters in which more than 50% of persons are infected. Because so many people are in such close proximity with poor hygiene, things like that, the homeless shelters are major sites of transmission. And screening by X-ray periodically in all residents, or specifically in symptomatic persons, those people that are coughing, appears to be the most cost-effective approach for detection and diagnosis in homeless populations. Think about the probability of being able to contact that person again, doing that chest X-ray there and getting results a little bit faster, not doing a two-step. You might not see these people again, so you want to get those results. Number 50. Last one is, of course, a math question. In a case control study, the association between obesity and Clostridium difficile was examined. The table below provides the results. Which of the following odds ratios is correct? Ratios, not rations. A, 0.35, B, 2.85, C, 1.83, or D, 0.55. Give you guys a second to do the math. All right, we're getting a good mix of answers here, B, C's, and D's. Chat box, we've got some C, D's, and A's. And the correct response is B, 2.85. So if you look at this, this is how you would calculate your odds ratio with this 2x2 table. It's basically A times D divided by B times C. So it's 55 times 70 divided by 30 times 45 will give you 2.85. All right, so that is the end of this slideshow. We will move on to our next section, which should be a little bit easier than doing math the whole time every week. That was definitely the hardest PowerPoint chapter that we just completed, so congrats to you guys for getting through that. I know it can be a little bit painful. And I'm just gonna, and please bear with me while I change my screen. Okay, good, looks like you guys got it. Switch displays. Alrighty, and can everyone see the preventing, controlling the transmission of infectious agents? Great, okay. So this section, chapter 5, has about 25 questions on the CIC exam, and we'll go through 50 on this one. So, number 1, a woman in active labor with confirmed influenza has been admitted to an acute care facility. Recommendations for preventing influenza transmission between hospitalized infected mothers and their infants include all of the following, except the mother should be placed on droplet precautions. The baby should stay in the same room as the mother. Keep the isolate at least 3 feet away from the mother when she is not interacting with the baby. Or D, the baby should receive formula during the 5-day period following the mother's symptom onset. When we switch over, it takes a few minutes sometimes. Okay, there you guys go. All right, so for this one, we're actually, between the chat and poll everywhere, we're getting responses for everything, all of the above, A, B, C, and D. And the correct response in this question is D. The baby should receive formula during the 5-day period following the mother's symptom onset. So when thinking about pregnant women with influenza, they are at increased risk of hospitalization and influenza complications. Pregnant women with influenza should be placed on droplet precautions. The pregnant woman is not required to wear a mask during labor or at the time of delivery. You still want to room newborns with the mother placed in isolette if available, 3 feet from the mother when she's not interacting with the baby. Mothers can still breastfeed, but should put on a surgical mask during these instances and practice hand hygiene before each feeding or other close contact with their infants. And you just want to keep doing this during the 5-day period following the mother's symptom onset. Number 2, most healthcare-associated pathogens are transmitted from patient to patient via improper isolation practices, inadequate sterilization of medical instruments, hands of healthcare personnel, or lastly, ineffective disinfection of medical devices. All right, you guys are 100% correct. Hands of healthcare personnel. This is something, it's hard, definitely hard to keep people excited about this, but this is one of the most important things that we can do. And I did have a question about getting the Poll Everywhere link, Tatyan. So once I go to a Poll Everywhere slide, it's right at the top there. It can tell you how to text in, or you can go to to the website. The only issue is if more than 50 people have already logged in, you won't be able to, just because of the cost, we aren't able to cover more than that at this time, unfortunately. It just isn't possible. Okay, number 3. A patient is admitted with pruritic lesions on the hands, webs of fingers, wrists, extensor surfaces of elbows and knees, and the outer surfaces of the feet, armpits, buttocks, and waist. What type of isolation does this person require? Contact, droplet, airborne, or no isolation is required? Right, most people are going with A, and that is correct. You want them in contact precautions. So, APIC loves scabies. I'm pretty sure from what I've heard from Patty, every test has scabies on it. So mice are transmitted by direct contact with infested persons. Less frequently, transmission may occur through contact with clothing or bedding. These would be the fomites. You can spread the mite to different parts of your body if you're scratching, and due to the high risk of transmission, you want to consider this diagnosis in any patient with a pruritic cutaneous eruption, especially if they're having it on their hands, wrists, or elbows. A hospitalized, institutionalized patient should remain on contact precautions until 24 hours after treatment. Number 4, an autopsy is ordered when a patient who is diagnosed with TB. Which of the following statements is correct regarding postmortem care of a deceased TB patient? Autopsy rooms should be at positive pressure with respect to adjacent areas, and room air must be exhausted directly outside. An oscillating autopsy saw should be used to reduce the infection of aerosols. An approved mask is necessary for respiratory protection, or standard precautions are sufficient because Mycobacterium tuberculosis needs a living host to survive. All right, most people are going with C here, and that is correct. You definitely want to have an approved mask for your respiratory protection. So according to OSHA, autopsies are known to, on a known or suspected case of TB, is a high hazard procedure requiring personnel to use approved respiratory protection. In areas where TB is prevalent and health history is unknown, respiratory protection is prudent, especially for medical examiners' cases. Number 5, which of the following patients is not a high risk for healthcare-associated fungal infection? Burn patient, premature baby in the NICU, bone marrow transplant patient, patient who underwent joint replacement surgery. All right, most people are going with D. That is correct, a patient who underwent joint replacement surgery. A little bit more about fungi is that they're increasingly being identified as healthcare-associated pathogens. A patient at high risk for an healthcare-associated fungal infection includes patients with leukemia, solid tumors and leukopenia, bone marrow transplant patients, injection drug users, patients who have undergone intra-abdominal or cardiothoracic surgery, burn victims, premature or low birth weight babies. Number 6, the infection preventionist receives a call from a nurse who is scheduling a patient for surgery at her ambulatory surgery center. The nurse tells the IP that the patient is colonized with methicillin-resistant Staphylococcus aureus. Which of the following best describes colonization? The presentation of clinical signs of illness or inflammation, an acute bacterial disease caused by obligate anaerobic non-spore-forming rod, the permanent presence of bacteria that is part of the normal flora, or lastly, the presence of microorganisms without the signs and symptoms of an infection. All right, everybody is going with D. And that is correct. The presence of microorganisms without the signs and symptoms of infection best describes colonization. Number 7, what type of respiratory protection mask is recommended for immune and non-immune healthcare personnel when caring for a patient with smallpox? Is it a surgical mask, exam mask, N95 or higher level respirator, or a procedure mask? All right. You guys are very confident in these ones. 100%. You guys are doing great. N95 or higher level respirator. More about smallpox is that it's a disease caused by variola viruses like the orthopox virus genus. It was eradicated from the human population in the 1970s as a result of a worldwide immunization program. It doesn't have an animal reservoir. The occurrence of infection would be the result of intentional exposure from a bioterrorism attack. Smallpox does spread via droplet, airborne, and hand-to-hand contact. If we have even one case of smallpox, it would be a global health emergency because 42% of the population has never been vaccinated, and the length of immunity is unclear with vaccinated. And judging by how it spreads so many different ways, you would have a very, very serious problem if we ended up having even one case that spread. Like Contagion, that one movie, just I could imagine it spreading everywhere. An outbreak of aspergillosis is suspected after several oncology patients are identified with positive cultures. The IP suspects a heating, ventilation, and air conditioning or HVAC malfunction and begins an outbreak investigation. The IP has been asked to make recommendations for environmental cultures. All of the following needs to be considered except identifying the purpose of culturing and appropriate methods beforehand, meeting with the facility legal staff to discuss notification of patients, anticipating decisions and planned actions to results of culturing before undertaking the process, or determining whether there are existing standards to interpret results. All right, most people are going with B, meeting with the facility legal staff to discuss notification of patients. That might be something to consider way down the line. See if we have anything else about this. One thing I was glad to see nobody picked A, identifying the purpose of culturing and appropriate methods beforehand. This is something that we think about with Legionella and a lot of the water management plans. You know, there's no point in taking cultures or samples if you don't have a plan of what you're going to do with them, because you might get results and they're not useful in any way. And if you don't have a plan, like, why are you wasting the time to do it, the money? You need to have a good idea of these and what their use is. Number 9, the U.S. Pharmacopoeia recommends that multi-dose vials be disposed of 14 days after opening, 30 days after opening, 28 days after opening, when all the medicine has been used. Right, between B and C, mostly C's, and that you're correct, 28 days after opening. Number 10, the policy for therapy animals in healthcare facilities should include all of the following except hand hygiene must be performed after contact with the animal. Animal must be bathed within 24 hours prior to visiting the healthcare facility. Animals must be healthy and current with immunizations. Small animals are never allowed to sit on a patient's bed. All right, most people are going with D. I can get this mouse to work here. And that is correct. Small animals are never allowed to sit on the patient's bed. That is allowed. Heard something the other day that was interesting about them trying to bring in hedgehogs, which are the new hot thing. So, you know, they're just carriers of salmonella, so it might not be the best idea. Number 11, an IP has been asked to provide infection prevention consultation to a long-term care facility. As part of this consultation, she checks to make sure which of the following program components are in place: decolonizing residents with MRSA, establishing an antimicrobial stewardship program, implementing an annual influenza vaccination program, or collecting environmental cultures of high-touch areas. You can choose 2 of the above. Right, most people are going with 2 and 3. That is correct. So let's go to the next slide to look at the correct answer. Shows up a little gnarly. All right, so you definitely want the program components of establishing an antimicrobial stewardship program and implementing an annual influenza vaccination program. Number 12, a hospital is beginning a major construction project. The IP has been asked to join the planning team to assist with the development of the infection control risk assessment for the project. What is the purpose of an ICRA? Develop and oversee the construction project schedule, minimize infectious hazards for patients and healthcare personnel, provide direction for level 3 and 4 projects only, or coordinate system startup. Survey says you guys are right again, 100%. Minimize infectious hazards for patients and healthcare personnel. That is the purpose of an ICRA. This chapter is much nicer than the previous chapter, huh? All right, number 13. An antibiotic timeout occurs daily, weekly, within 24 to 48 hours of culture results being available, or within 96 hours of culture results being available. Right, we have a draw between daily or within 24 to 48 hours of culture results being available. The correct response is C, within 24 to 48 hours of culture results being available. I wish we could do them daily. That'd be amazing. Gives you a little bit extra cushion with that 24 to 48 hours with your culture results being available. So the CDC advocates antibiotic timeout. Much of antimicrobial prescribing is unnecessary or inappropriate. An ATO should be taken when culture results are available, usually within 24 to 48 hours. And I'm just curious how many of your facilities are doing these antibiotic timeouts within the recommended 24 to 48 hours when you have those results. Feel free to type that into the chat box. And also, providers must formally assess 3 pieces of essential information during clinical rounds for this. You want to make sure you have the correct dosing, duration of therapy, and indication for treatment. All right, so looking, let's see what everybody's doing. So we have some people saying yes, some people saying no. Some people do it informally, it looks like, and others only in higher risk populations such as the ICU. Oh wow, one facility has the antibiotics inpatient are reviewed daily by the pharmacist. So an outpatient is definitely a struggle. It's something that we're focusing on here, and it's just a whole nother world than inpatient. But it's interesting to see how big and vast of a difference we have between all of our facilities in doing antibiotic stewardship. Definitely important. Sometimes it is hard to get buy-in, especially from prescribers, because there's been studies where people think that their patients are different than everybody else's. They think they're doing okay and everybody else is messing up. And that's why we're having these problems with antibiotic resistance and things like that. So it's definitely